Today we're going to talk about a different matrices system for filling restoration. Let's start with the back teeth restoration. Most of the time, a lot of people do not use flosses, and they've got bacteria and acid that dissolve in between of the teeth. Therefore, we need to make a restoration in between the teeth. To do that, we will use a sectional matrix right here. It's got the S small size, medium with the large, meaning this is the extension of medium, and the large size. And these are the wedges, which if we take one, I will show you. If we take one right here and take one of the matrices system, what we would do with these is this will get placed in between the teeth like this. So if we're doing any fillings that's in between the teeth like this, okay, you will need a sectional matrix, and then you will need a wedge like this, and the wedge goes in between the teeth like this, so that when filling restoration get placed right here, it doesn't just overflow doesn't just go into the gum. Okay, this is how we do it. And with these systems, we usually use it with a sectional matrix. Sectional matrix looks like this. This is a Garrison sectional matrix. To use that, we need to use a faucet right here. This goes in a pair. It goes like this, and we clamp it onto it, so it forms a shape for the fillings restoration. So this is the interproximal restoration needs. So a wedge, a sectional matrix, and the sectional rings. Okay, so if we are doing occlusal fillings or the buccal fillings for decay cavity, you do not need any matrices, unless if somebody brushes their teeth away or they have decay cavity that happens surrounding the gum right here, we would then need to use Teflon tape. Okay, the Teflon tapes get placed surrounding the gum, and its sole function is to retract the gum away so that we can access the tooth directly, and then we can do the restoration properly. Teflon tape. Now, if we're doing a front tooth interproximal filling, this decay cavity happens when people tend to suck lollies or eat stuff that is sweet or refined carbohydrates. Just hold it on the palates right here, so the acids goes in here, and this is the most common area for restoration. In that situation, you need a clear matrices like this. So if we're doing any fillings on the front, you need a clear matrix or clear strips, you call it. Okay, you put it in between the teeth, just like how you put the sectional matrix in between, and you will need a wedge with this. Usually with the front teeth, we would want to, unless for special circumstances, usually we would like to use small wedges. Okay, we do not want to cause any damage to the gum, so this is what I like to use. Okay, clear matrix. Last but not least, this is this. Last but not least, this is a Toffelmeier matrix band. It looks like this. Okay, and this usually we use it with amalgam in the past, but in the modern restorative situation, we really need to use this unless the tooth is really broken down and we're using it to form a shape for restoration. And how we put this in is, this is a Toffelmeier matrix band holder. What we can see is there's two screw. Okay, the first screw at the back, its purpose is to hold the Toffelmeier matrix band in place, and the second screw is to tighten the Toffelmeier matrix band. And for say if we're doing a fillings on the lower right hand side, okay, if you make this hole, okay, you can see that this is a smaller hole, and this is a bigger hole. Okay, the bigger holes, the bigger opening always goes to the top, to the occlusal surface. Okay, if we're doing a fillings on the lower left hand side right here, so just bear in mind, if you are going to prepare the holder needs to sit next to the teeth on the outside. It cannot go to the back, because otherwise this will be going into the throat of the patient. So if you have that in mind, you want to screw the second screw so that the first and second bit is joined together, and put this in. If I put this in, this is not going to sit on the teeth, so I have to bend it in here, and then now I'm screwing onto the first screw to tighten, to lock the Toffenmeyer matrix band in place. Now you cannot dislodge it. Now coming to the tooth, I would then be putting this over the tooth right here. Once I put it over the tooth, I would then screw onto the second screw to tighten the rubber dam, tighten the Toffenmeyer matrix band. This is all that we do. Okay, this is to build up a very severely broken down tooth. Now you can go do some exercises, try to find out try to go for sectional matrix band, choose an appropriate teeth for appropriate wedges for specific teeth. Okay, let's do some exercises and try to set up Toffenmeyer matrix band, and try to pick up clear matrices and also Teflon tape.